We do a 1 minute countdown, ladies and gentlemen. Yeah, that's shutting up. Good afternoon and welcome to today's Health and Wellbeing Board, held in person in Huddersfield Town Hall on Thursday the 22nd of September. So we'll start with item 1, which is membership of the board and apologies. Shall we do apologies first, please?
We've received apologies from Councillor Cash Pinnock, Mel Meggs, Tom Brailsford will be subbing for Mel, James Cregan, Superintendent Jim Griffiths, Liz Mear, Sean Rayner. We've got Caitlin Davis who's subbing for Sean. We've got Vanessa Taylor subbing for Nick Hardiker, who sent his apology. We've got Emma Hall, who will be subbing for Len Richards, who sent his apologies. We've got apologies from Rachel Spencer Hensel. We've also been notified that Councillor Khan will be attending, but she will be slightly late. Thank you, Chair.
Thank you very much for that. So if, for the benefit of anybody who may want to watch this online, I will ask people to introduce themselves and say where they're from as such. So I'll start it off. I'm Councillor Viv Kendrick. I'm the Chair of the Health and Wellbeing Board, and next to me is...
Phil Longworth. I work for the Council and part of my role is to support the Health and Wellbeing Board.
I'm Alex Chaplin, and also part of my role is to support Health and Wellbeing Board as Strategy and Policy Officer for Adult Social Care.
Hi, I'm Carol McKenna. I'm the Accountable Officer for Kirklees Place within the West Yorkshire ICB.
Hello, I'm Karen Jackson. I'm the Chief Exec at Locala.
Hi, I'm Catherine Riley. I'm Associate Director of Strategy at Calderdale and Huddersfield NHS Foundation Trust.
My name is Richard Parry. I'm Strategic Director of Adults and Health at Kirklees Council.
I'm Councillor Carol Patterson. I'm the Cabinet Member for Learning, Aspiration and Communities.
I'm Emma Hall. I'm Chief of Planning Partnerships at the Strategy at Mid Yorkshire Hospitals NHS Trust.
Hi, I'm Caitlin Davis, a Policy and Strategy Graduate Management Trainee at South West Yorkshire Partnership NHS Foundation Trust.
Hi, I'm Alistair Brown, Chief Executive of Kirklees Active Leisure and here representing third sector leaders.
Hi, I'm Christine Fox, Director of Neighbourly Places at Connect Housing and here for West Yorkshire Housing Partnership.
Mark Thompson, Councillor from Kirklees.
Vanessa Taylor, Director of Practice and Care Partnerships at the University of Huddersfield, representing Nick Hardiker, the Dean.
Stacey Appleyard, Director of Health Watch Kirklees.
And Dale Gardner from West Yorkshire Fire Service, Kirklees District Commander.
Hi, I'm Esther Ashman, Associate Director of Strategy for the West Yorkshire Integrated Care Board.
I'm Owen Richardson. I'm the Data and Insight Enablement Lead for Public Health at Kirklees Council.
I'm Tom Brailsford, Service Director for Kirklees Council Children's Services and representing Mel Meggs today and the item on send.
I'm Jenny Bryce-Chan, Governance Officer.
And also joining us online because of health issues as such, we have Emily Parry-Harris. Emily.
Thank you very much, Councillor Kendrick. I'm Emily Parry-Harris. I'm a consultant in public health. I'm here today for an item on the agenda, but I'm also here as sub for Rachel Spencer Henshaw, the Director of Public Health.
Thank you for that. We do also have Councillor Jackie Ramsey, who's joining us, who is an observer to this meeting. Hello, Jackie.
Hiya, thank you very much. I'm just observing. I'm the lead member for the Health and Social Care, for the Health and Adult Social Care Scrutiny Panel.
Thank you very much. If we could then move on to minutes of the previous meeting, of the meeting held on the 30th of June 2022. I'm really looking to see whether anybody feels there are any amendments needed or omissions. No one's seen anything as such, and therefore I'm asking if the board is happy that these are a true record. Yes? Nobody's saying no. I will take that as a yes. Thank you very much. Interest, if any board members have an interest, a pecuniary interest of an item on the agenda, please complete the form that's available in the pack and make sure that Jenny has it as soon as possible. This is a meeting held in public, so it is open to any members of the public who wish to attend. Deputations and petitions, Jenny, have we any?
None received, Chair.
Okay, public questions?
Again, none received.
Thank you. So we will move then swiftly to item 7, which is the Health and Wellbeing Board Terms of Reference update, which Phil is going to take us through.
Thank you, Chair. This is just to update the board following the discussion at the previous board meeting where we discussed the amended terms of reference. And at that meeting, I think we hopefully clarified that because this board is a subcommittee of the council, the revised terms of reference then need to go through the council's internal process to get formally signed off. And that has been completed now, and they were approved by full council at their most recent meeting. So as from this meeting, we will be operating within the terms of reference attached, including agenda item 7. That's also meant that we've updated the membership of the Health and Wellbeing Board and several of the new members in the meeting today. We've still got a couple of places to fill in terms of the membership, and we expect by the next time the board meets in November, we'll have those places filled, so we'll have a full set of members. Just another thing to note, that between now and the next meeting, we'll also need to think about who's going to take on the role of the vice chair of the board. So we'll be bringing something to the next board meeting to formalise that appointment. So, thank you, Chair.
I don't know if anybody has any comments or questions. No? Okay, that's here for information as such. So we'll move swiftly on then to item 8, which is the 2022-25 Pharmaceutical Needs Assessment Update. And Owen Richardson is going to take us through this. Over to you, Owen.
Thank you very much. Yeah, just very briefly, we're working through the process of publishing the next PNA, the Pharmaceutical Needs Assessment. It's due for publication by the 1st of October this year. A draft copy of the report was circulated around June time and went out for public consultation, 60-day consultation. The latest version that was circulated with the agenda of this meeting incorporated the feedback that we'd got from that consultation process, which was very minimal feedback, and also updated the data that was used, so things like services offered and opening times. So the latest version that's been circulated is the version that I'm proposing that we publish. There's no gaps identified in terms of pharmaceutical provision in Kirklees. So looking for the board to approve that, and then we'll put it on the website as soon as possible before the 1st of October.
Any questions or comments? No? We are asked to, it's recommended that we sign off the final version of the Pharmaceutical Needs Assessment. Everybody happy to do that? You may indeed. Over to you.
Thank you, Chair. I have an admission, first of all, that I haven't read the Pharmaceutical Needs Assessment, but I have a question on the back of it, and just wondered if there was any comments or actions to be done on repeat prescriptions sent to elderly or infirm individuals that can't stop the prescription. And I guess one of the reasons I asked this, I've just cleared out a house for an elderly person and filled 2 bin liners full of prescription drugs in that house, and just saw the wanton waste of prescription drugs there, and just wondered if there's anything that we could do, or if there was anything in the document to be able to cure that, if you'll pardon the pun.
There's nothing in the document that addresses that. I don't think that's in the scope of the pharmaceutical needs assessment. I can take that away and see what I can find out for you there.
I just wondered maybe we could direct that question to Ruth Buchan from Community Pharmacy West Yorkshire. I know it's a question that's asked quite frequently, and there are rules around the return of medicine, but I would defer to Ruth in terms of providing an answer to the board, if that's okay.
Absolutely. One of the things that it's worth noting is that on the list of updated list of membership of the board includes Community Pharmacy West Yorkshire, and Ruth will be the rep on the board. So if I can undertake to have a conversation with Ruth, she's on holidays at the moment, which is why she's not here. I'll have a conversation with Ruth and find out what the response is, and if it needs something in a bit more detail, then we can deal with just via sending an email. I'll ask Ruth to update the board at the next meeting.
All right, thank you for that. So I therefore return to, are we happy to sign off this final version? Yes? Fine, thank you very much. So we move to item 9. It's page 11 to 211 to 242 in your agenda. It's the Joint Health and Wellbeing Strategy, and Emily Parry-Harris is kindly joining us to take us through this. Over to you, Emily.
Thank you very much, Chair, and I really am grateful for being able to dial in remotely. Phil is going to share the slides, and I am going to do my best Chris Whitty impression and ask him to move them on. I'm conscious there are a lot of slides here, and I'm also conscious that the board has seen a very late draft of this document previously. There are a few changes that I will draw your attention to specifically, but I'm gonna whiz through these slides at a reasonable pace to give us time for discussion of the questions that I'm going to pose at the end. Just to remind you, you previously saw the, as I say, very late draft of this document previously on the 30th of June when it was presented to you by Rachel Spencer-Henshaw and Phil Longworth. And the response to that previous presentation was we were encouraged to engage with partners, which we were doing as part of its development anyway, prior to sign off, and to simplify some of the particular elements. We've done that, and I'm now presenting the final version of the health and wellbeing strategy to the board today, hopefully for sign off. Before I carry on though, the most important thing that I must do is thank those people who've done the hard work of putting pen to paper and facilitating all of those conversations that have happened in order to get us to the point of the document being finalised, and specifically that's Phil. He's done an enormous amount of work on this. Stacey Appleyard, who's in the room, Joe Hilton-Jones, Alex, you're also in the room. You've done a huge amount of work on this, and Rachel Milson. It'd be really remiss if they were not thanked for the work that they've done. So as I say, I'm going to go through these at pace. The background to this is that the health and wellbeing strategy outlines our shared commitment to improving the health and wellbeing of all of the people who live, work and study in Kirklees, and that way of describing the people to whom this strategy applies is really important, and to remind the board that this is a statutory responsibility via the Health and Wellbeing Board. It forms part of the Council's policy framework. It also forms part of the ICB's statutory arrangements as well. So it's not just a thing that's nice to have, it's an important document that people are required to refer to and take account of. Also take the opportunity to remind the board that this is a high-level strategy. It's about setting the tone, it's about saying how we do stuff around here, and it will then be supported by a range of specific strategies and plans, and that what comes next is an important question for the end of this presentation. And the Health and Care Partnership will have a key role in shaping the health and care services to deliver on the joint health and wellbeing strategy. I hope everybody's keeping up with the acronyms. I apologise for them. Next slide, please. So in terms of how we've gone about this process, we have done lots of engagement, lots and lots of conversations. Lots of you in this room will, in that room rather, will have been engaged in this process. We've taken feedback from local partner organisations. We're very grateful for that. We've made heavy use of the Currently Living in Kirklees survey, which has been presented to the board previously. Healthwatch have been a really significant partner in developing particularly the I statements, which set the tone and help us to really articulate what's important to local people. We've also made use of pre-existing local and national intelligence, so the KJSA, the Director of Public Health Annual Report, and key national reports such as those developed by Michael Marmot. I'm not going to read through the detail, but you can see we've engaged with a range of partners as well. Next slide, please. So in terms of what's changed since the previous JAWS was developed, so the previous JAWS was approved in 2014, and I think the world has changed more than any of us could probably have imagined that it would do in that intervening 8 years. So obviously we've had the COVID pandemic. We are experiencing the cost of living crisis. The climate emergency has become much more prevalent and much higher up people's agenda. Really significant changes to the partnership landscape, the development of the ICB, a real shift to moving and talking about localities and neighbourhoods and communities, recognising that the geography of Kirklees, as we describe ourselves, is useful for our purposes, but people don't necessarily identify with that. They identify with the towns, villages, and even the streets that they live within, and some very significant changes at West Yorkshire as well. And we're trying to find our place in being part of that whole kind of complex jigsaw puzzle, if you like. There's also been much more significant recognition of the importance and the impact of poverty and housing on people's health and well-being. We always used to talk about that only a proportion of your health and well-being was related to whether or not you've seen a doctor. The rest of it was about how and where you lived your life. But we are much clearer on the really significant impact that poverty and housing particularly has. A real lens that we're looking everything at now on tackling inequalities and promoting inclusion. Recognising and understanding the importance of working with distinct communities, of going to them, of noticing who we're not engaging with and proactively doing something about that. And that links to the next point about working with communities and individuals, not just doing things to them or for them. And the real potential of digital technology to make people's journeys easier and better, and maximising the use of that. Next slide, please. Really important that we recognise that the health and wellbeing strategy is part of how we improve the lives of the population of Kirklees, and recognising the interdependencies between the health and wellbeing strategy, the inclusive communities framework, the inclusive economy strategy, and the environment strategy. And I've got a slide a little bit later that will describe how those things will fit together. Next slide, please. So this will probably be a familiar concept to members of the board. It's been updated for inclusion in the health and wellbeing strategy refresh. And we are waiting. The last tiny little thing that we need our comms team to do is make it much more obvious that poverty is a really important factor in people's health and wellbeing, but that is the only thing that will now change. But what we are trying to demonstrate here is that there are a whole range of things that impact on people's health and wellbeing. Some things are beyond Kirklees, and while we can respond to the impact of them, we can't necessarily influence them to be any different. But really recognising the importance of the wider determinants, and that as I referenced, the how and where you live your life, and the impact that has on your health and well-being. Next slide, please. So again, members of the board will have seen versions of this slide previously. You've probably seen it with the two boxes, well, the second and third box, the equality and equity. What this is trying to demonstrate is that what we need to do within our health and wellbeing strategy is do more for those people who need more in order to create equity. But absolutely ideally, what we will be doing is moving towards removing that fence altogether, so that everybody is included and we don't need to give anybody a box to stand on. I think a picture tells 1,000 words, doesn't it? So hopefully that's a useful demonstration of that concept. Next slide, please. I made reference in my introduction to who this strategy is about. This is for people of all ages who live, work or study in Kirklees, because we recognise that all of those people contribute so much to what it is that makes this a vibrant and good place to live. Next slide, please. I made reference again in my introduction to the I statements. We've developed these with, I say we, Healthwatch, have done a huge amount of work around this, and it's very much been informing the things that we pick out and the things that we emphasise within the health and wellbeing strategy, because it's what people have told us is important to them. Again, I'm not going to read them all out to you. You can see them all, but I wanted just to draw people's attention to the fact that there are specific things that people have told us are important to them, and the strategy is in direct response to those statements. Next slide, please. So our vision for the health and wellbeing strategy, people who live, work or study in Kirklees live their best lives with good health and wellbeing, free from inequality, stigma, discrimination and barriers, so that they can do and enjoy the things that matter to them. And it's the things that matter to them that is particularly important here. Again, I'm not going to read through all of the specific values. You've seen them before. But they are the values, and as I said in my introduction, the strategy is about setting the tone about the how we do stuff round here. Next slide, please. Just to dig down into those values a little bit more, the ways of working, the JAWS approach. We work with communities, we don't do things to them. We recognise that who you are and where you live impacts on your health and wellbeing. We make the most of our diverse communities and the skills and experience that exist within them. We work to strengthen the skills in our local communities. We have the courage to be creative and innovative. We make sure that our work is intelligence, evidence and insights driven. We focus on prevention and early intervention. We build and maintain strong relationships. We recognise that building and maintaining strong relationships takes effort and time. And we provide high support and high challenge to partners and colleagues. Next slide, please, Phil. This is just to remind people that the health and wellbeing strategy is specifically in support of the shared outcomes that exist within Kirklees. There's a further slide that it describes the interplay between these, but just to remind people of the 8 Kirklees outcomes, and that the health and wellbeing strategy specifically, but not exclusively, focuses on the children have the best start in life, people in Kirklees are as well as possible for as long as possible, people in Kirklees live independently and have control over their lives, and the newest outcome, the Shaped by People one, about we make our places what they are. Next slide, please, Phil. So this is just a summary slide, really, to try and put it on a single piece of A4 to say these are the outcomes that the JAWS will focus on, the priorities that have been identified as being particularly important for improving the health and wellbeing of the population of Kirklees, those being mental wellbeing, healthy places and connected care and support. And then in delivering each of the priorities, we will do that through the lens of the life course and those 6 key factors. And I talked about those earlier as being things that we now understand to be particularly important in terms of shaping people's health and wellbeing. So inequalities and inclusion, shaped by people, poverty, digital, housing and the climate emergency. Next slide, please. Okay, so this is the slide. This is I always have a favourite slide in any presentation, and I think this is probably my favourite slide in this presentation, because what it does is it shows how by each of the 4 top-tier strategies working together, they will become greater than the sum of their parts. It's not intended to say that the Inclusive Communities Framework will only look at safe and cohesive and shaped by people, but it is saying that that will be the primary space in which those outcomes are owned, and we will bring them all together to say this is how the 4 strategies link up and complement and add to the power that each of them have. Next slide, please. Again, this is a useful slide in that it's indicating the range of things that we as partners across Kirklees need to be cognizant of. So you've got the 4 top-tier strategies in the middle, you've got the 8 shared outcomes running across the top, and then the specific plans that will mobilise the actions contained within each of the strategies. And as I said at the beginning, really important that we recognise that this health and wellbeing strategy isn't just something that's nice to have. It actually forms a really important part of the governance processes of both the council and the ICB. Next slide, please. So we need to develop a health and care plan for Kirklees to detail how the health and care partnership will deliver primarily the connected care supported priority in the refreshed JAWS. We need to recognise the interdependency between the healthy places and the mental wellbeing priorities. We need to respond to the West Yorkshire ICP 5-year strategy and the forward plan. And we need to respond to the anticipated refresh of the national strategic priorities. And as I've said a couple of times now, this is about setting our tone. It's about saying what our vision is, what our values are, how we do stuff around here, and that we can reflect on whether the things that we are doing in Kirklees are meeting those visions and those vision and values. Next slide, please. So this is the last one, and these are the specific questions that I would like to, if we can, spend a bit of time discussing today. But this isn't the last time you're ever going to talk about the health and wellbeing strategy, and it will crop up in lots of other spaces as well. So the things I would specifically like to ask you to think about: how will the Health and Wellbeing Board use the JAWS? How does the JAWS shape the work of the Health and Wellbeing Board? How do we make sure this is an active thing that we refer back to? We don't just go, well, that was pretty, it's lovely, we'll put it on a shelf. How do we actively use it? How can the board support embedding the JAWS in the culture of our organisations and partnerships? And how do you as the board want to assess the impact of the JAWS? How do you want to assure yourselves that it is making a difference? And that is my last slide.
Thank you very much, Emily.
Welcome.
Plenty of information there. If we can leave that slide up so people can see it. I don't know if anybody got any initial first impressions or comments they want to make on any of those questions that Emily has put to us. Round. Oh, Stacey.
Hi, Stacey from Health Watch Kirklees. I would say, just because of the involvement that Health Watch have had, particularly with the I statements for the Joint Health and Wellbeing Strategy, is that to shape the work of the Health and Wellbeing Board, it would be really interesting to try and take some of those shared outcomes or some of the factors or some of the I statements to theme some of the meetings in the future, so we know that it's there and we're constantly looking at it. So obviously, as Emily says, that it's not put on a shelf and forgotten about, maybe theming some of the meetings around some of the content so that we can have discussions about that.
I think that's a very, very good suggestion, something that we can bring forward to future meetings. It's right, it's not just, oh, those are what people said and then we forget about it. What is it we're doing and delivering to address those issues? Anybody else with any questions, comments? Carol?
Thank you. And I reinforce what Emily said there about thanking everyone that's been involved in this, because it's been has been an extensive piece of work. I really like the way the strategy talks about the other supporting and enabling strategies. So delivering on the JAWS is not only the role of the Health and Care Partnership. Clearly, the Health and Care Partnership has a strong part in that, but as we've just talked about, because of, you know, the economic factors, the poverty that we see, sectors such as the economy and education and elsewhere have a huge role to play in that as well. And I just on that, is it the fourth bullet point or the third, about how the board supports embedding the JAWS in the culture of our organisations. I think I can see how there's a direct connection between the Health and Wellbeing Board and the Integrated Care Board Committee. We've got several of us are on each. There's a direct link. I'm interested in how we make that connection with some of the other sectors, such as the economic sector. Do we have a shared dialogue with them? Do we invite them into a meeting for a conversation? It's how we do that, I think, is less obvious to me and something we might just want to think about as we move forward.
I think that's a very good point, and of course no one board or organisation can address the challenges of poverty or houses unless any of you are going to build a load of houses for us. So it is about working together, but I think that's a really good suggestion, that we need to look at how we make that connection together and how we can work together effectively. Anybody else? Yes, Karen.
Thank you. I mean, I think this sort of captures everything that we've been talking about for a while. What I'm interested in links to what Carol's talking about there, and it's a bit about so how will we know and how will we be able to adjust this as we go along, as the world changes around us. So I'm just interested in sort of, so how will we know then? How will we be assured that everything that we're striving for in here, we're actually achieving?
I'm now regretting deleting one of the slides that addressed
I was just going to say that. We had a brilliant slide that answered that we took out, didn't we? Yeah.
Do you want me to pick that up, Emily? So
yeah, do you mind?
In the strategy towards the end, we tried to set out how we think we can approach that. And I think it's about having those, a bit like Stacey was referring to, having that sort of check and challenge process, and that needs to operate across a number of sort of elements of the strategy. Because if people are coming to the board and it's not clear that they've embedded the vision and values, they're thinking about the I statements, they're thinking about how to contribute to the priorities, how they've considered the factors. So I think there's something in there, but it can't only be when people come into the board. And I think what we've tried to describe, start describing the strategy is it needs to happen at the Health and Wellbeing Board. It needs to happen in that range of partnership arenas that so many of us spend quite a bit of time in. But it also needs to happen in organisations. And I know, just picking up on the response we got from Locala, there was a really good, and we had similar from TSL and Kirklees Active Leisure, a really considered response to the previous draft, saying this is how we think we are contributing, and here are some of the things we think we can do a bit more of or do a bit differently. I think it's how we promote that sort of culture. So.
I think also if we were to take Stacey's excellent suggestion of having themed meetings, that will be part of how we are able to tell whether we're making a difference, because it will give us an indication of how real those conversations are.
Thank you, Emily. If I can bring Alistair in.
Thanks, Chair. Yeah, I mean, I really do like the health and wellbeing strategy that's been developed, partly because it's got a lot more emphasis on physical activity, which is a really good thing, and I'm obviously pleased to see that. But I think it does set a really quite a clear focused direction, and I suppose in a large way it provides the work plan, doesn't it? You know, those three priority areas, it should be the work plan for the Health and Wellbeing Board, and I would certainly be expecting feedback on each of those priorities, you know, to be coming to the board meetings really going forward with that. The initial stage of comms and engagement plan is really probably what we need, you know, to cascade down really the strategy and what's involved in that, and to try and share that understanding. And I'm sure all of us can take that back to our respective organisations and try and share that message and that positive side from that as well. I think that's quite a straightforward ask, and I think Phil's coming along to, for instance, the CAL board in November, you know, to give a presentation on the strategy, which is quite right. I think my biggest concern with it is the comment about inequalities in it, because it's a 5-year strategy, and I certainly think I'm all for strategies being aspirational, but some of the lines in it free from inequalities. Unfortunately, where we are just now, that's very, very unlikely, you know, within 5 years. And I would certainly think that's set a very high line for us to get to. It should certainly be aspirational, but to have it in the vision, and I think in one of the value statements as well, is a big statement to make, and something that I don't think we'll be able to achieve because of the wider factors that we're all facing. But overall, I think the strategy is a great piece of work, and now we just need to make sure that it does make that impact on the ground and does improve local health and wellbeing if we can.
Thank you for that. I think I'm inclined to agree with you about free from inequalities. I still think it still should exist there, and it's a bit about what inroads we've made, what changes we've made, how we've moved towards it. I do think from really a lot of the comments, we ought to have a regular agenda item about feedback about how we're doing in performance as such, as a standard part of the agenda in future.
Just to draw the board's attention to the sort of the appendices where we've been working with the people who are leading on the 3 priorities. So there is actually a set of things that we are saying we think we should do, and I think it would be relatively straightforward to ask those leads to work with partners to bring back the highlights over a particular period and build that into a sort of quite a regular routine. If we did one at each of the Health and Wellbeing Board meetings for the rest of the year, that would probably be a useful way of spending some of the time of the board.
Yeah. Okay. I suppose I'll make a comment in terms of we have talked in lots of ways over a number of items about how much the contribution is from the community, from the third sector, from VCSs. And I think any, including the council and other organisations, has to think carefully where they commission or fund or support to ensure that those organisations can continue to be as effective as we know they have been so far, and we have ambitions for them to be more effective. So it is something that we need to hold at the back of our minds as times get tough financially. We mustn't forget the value of that, really, as much as anything. I'm looking to see if anybody else has any other comments or questions. No? You want to add something else?
I do want to add something else.
Indeed, off you go.
Just to reflect back some comments we had from various discussions in various fora as we were taking it round in this latest iteration, because people did challenge the use of the word joint health and wellbeing, the joint word in joint health and wellbeing strategy. And I think part of that came from, and it's reflected in the way the terms of reference of the Health and Wellbeing Board have changed. It was originally conceived in the year 2012, which feels like a very, very long time ago, where the idea was that the council and the CCG would produce a joint health and wellbeing strategy. And people were reflecting that it feels like we've moved so far in terms of it being a system that we probably simply just need to drop the word joint. And I know several of the places have already done that and say this is the Kirklees health and wellbeing strategy.
Yeah. Okay. I think we've come to the conclusion of comments or questions. Therefore, I would ask board members to look at page 214 of the documents. The recommendations are the Kirklees Health and Wellbeing Board is asked to approve the draft refreshed joint health and wellbeing strategy, and also to delegate authority to the Strategic Director of Corporate Strategy, Commissioning and Public Health to make any minor amendments which may be necessary to take account of comments at the board meeting. And I think that should be at board meetings, because I think this is a moving live document and it will change over time. Is the board happy to agree that? Yes, I'm seeing nodding heads. Therefore, I would thank Emily very much for her presentation, Phil for being the slide controller, and all the people involved in pulling together this work, which is a huge piece of work, and we are most grateful for that. Thank you.
Thank you all very much.
Okay, if I could then ask us to move on, please, to item 10, which is the West Yorkshire Integrated Care Board Strategy. Here comes another strategy. And very kindly, Esther Ashman has come along today to help us through this. Over to you.
Thank you, Chair. And just to remind you, I'm Esther Ashman. I'm the Associate Director of Strategy for the West Yorkshire Integrated Care Board. And I know not everyone likes to talk about a lot of strategy, and you've got a lot on the agenda today and a 20-page report from us, so apologies. But hopefully you'll see that actually these two strategies coming together today, it's following on from each other, is a really good sign of how we're trying to do things a little bit differently. Our strategies should be built from place. That's where we start, and so it's really good to see them together. And Emily kindly thanked Rachel Milson, who is working with us actually on the West Yorkshire strategy as well, and I know has worked hard to make sure the engagement that's been happening has been happening about both of those things at the same time, which has been fantastic. So I'm going to take the paper as read, but just focus on a few points to take you through, if that's okay, to give you some time for discussion. But as you'll be aware, now that we've moved into our new statutory arrangements as of the 1st of July, we have a requirement to either develop or refresh a 5-year strategy. And I say either because there are some integrated care systems up and down the country who aren't as lucky as us, don't have something in place already that we've worked on. We actually do have something that we published it back in 2019, which was the subject of a long period of engagement and co-production with communities and organisations, where we agreed a set of ambitions and we agreed a strategy. So we tried to take a little bit of a different approach to this time. We've pulled together a strategy design group, of which there are representatives from right across the breadth of the partnership. It really is quite an inclusive group, and it is growing massively as our movement is growing. I think we're up to about 40 people now, and we have people from all the places, all the collaboratives, the providers, voluntary community sector, Health Watch, a really good spread of people who've been fantastic to work with. And we're trying to, through the process of the strategy refresh, create a new way of working in the partnership to build system leadership and system development into that, so that we're using this process not as a going away and writing in a corner a document, but we're using it as a way to be able to deliver the strategy going forward. So we've co-designed the process with the group, and we've been engaging out in our own individual spheres of influence, so Rachel in Kirklees as an example, so that we can get much further afield for our engagement and try and get as near to the ground as possible, so that we can really get everybody's views encompassed in this, which has been really good. And actually what we've found is, as we've gone and engaged with groups, they've then wanted to go out further into their own little spheres of influence as well. So it's been really fantastic to see that move and the interest that it's created as part of that process as well. As I said, it is growing, so we are getting more and more people, and that offer is always open to organisations and community groups to join us in that. We do keep trying to build our little movement. So, as you will be aware, we do have that process in place, that strategy in place at the moment from 2019. And the message we've had over the last few months, because we started this back in March this year at Partnership Board with a conversation about the approach we would take. And we've really had a message back of, please do not throw those 10 big ambitions out. They're still absolutely relevant for West Yorkshire and the people of West Yorkshire, and don't completely rewrite a strategy. So we've gone from that basis, but equally listened to what people have said. So you'll see in the paper there's quite a bit of detail about what that insight is telling us and what impact that might have on the ambitions that we've signed up to. We don't intend to really do a massive refresh of the actual strategy itself. About 20% of the work is about writing a document, a high-level North Star strategy document, if you like. About 80% of the work is really about the delivery, which I'll come on to in a moment. Because part of the work we need to do is to make sure that, as Emily's just described, it's not a strategy that sits on a shelf, but is something that's really felt, the impacts felt by the people on the ground, and they're able to describe that things feel differently to them. So there is, as part of the work, you'll see in the document, we've got insight and evidence from people through Health Watch. They've done some mapping of what's actually been gleaned from our populations over the last couple of years. We don't want to go back out and ask the same questions and get the same answers. So we've done that as part of the work. And there's also the insight that we've had from our partners and our stakeholders as part of this as well in the document. So I just wanted to focus on a diagram that is in paragraph 66 in the paper, which just gives you a good overview about how everything fits together. And I think having heard what you've just heard on the Kirklees Health and Wellbeing Strategy and what you've got in the West Yorkshire Strategy, I think it just shows really nicely how everything fits together. So in that diagram, you've got a set of strategies. So you've got a West Yorkshire Integrated Care Strategy that is owned by the Integrated Care Partnership, and that in West Yorkshire is what we call our partnership board. That's a wide system. It's not just NHS organisations, it's housing, police, fire, all sorts of different people are on that partnership board. And that's a really high-level strategy to describe how we're going to meet the things that we know we need to do, the things that NHS England tell us that we need to do, but also what are the things that are really important for the people in West Yorkshire, so our 10 big ambitions. That's built from the places, it's built from things like Kirklees Health and Wellbeing Strategy, so building right from communities up to West Yorkshire. But we mustn't lose sight on the delivery as well. So come next month, we know we're going to have to start the process of setting out a joint forward plan, which will need to illustrate delivery of that strategy and delivery of the health and wellbeing strategies as well. So that will need to set out the NHS elements of delivery of the strategy. So that joint forward plan is owned by the Integrated Care Board. What we also need to do is to be able to demonstrate delivery of that at place as well. So as Emily described, having a plan for your for delivery of your Kirklees Health and Wellbeing Strategy, this is that plan. It will also describe the delivery of the Kirklees strategy and also the delivery of the bits that that Kirklees are contributing to of the West Yorkshire plan and the 10 big ambitions as well. All of that needs to align with other bits of planning that are happening in the place as well, such as the Better Care Fund, operational planning, winter planning and financial planning as well, so that holistically it all comes together to deliver those strategies and we get better at being able to really demonstrate the impact we're actually making with our strategies. And then at the right-hand side of that diagram, you've got the bits that are going to really help us deliver those strategies. So our finance strategy, making sure that it's not a finance-led strategy, that finance is helping us deliver it, and that we've got a strong people strategy, digital strategy, that we're using the right involvement with people, the right framework around that, and equality, diversity and inclusion strategy as well. So I just wanted to focus on that because that gives a good way of being able to see how it all fits neatly together. So given everything you've seen, in the paper you'll see that there's some bits highlighted as to what we think needs to change in our strategy as a result of what we've heard. It won't surprise you to know, as you've heard in the Kirklees strategy, poverty and cost of living come high on the agenda. Of all the engagement I've done, I don't think I've been anywhere where that's not been top of the list in the conversation. So we need to look at embedding that through our 10 big ambitions, and we've done some work with our strategy design group around that. I think you've got something on special educational needs this afternoon as well, and that's coming out very strongly, that we need to strengthen that and strengthen the children and people and families' ambitions to be able to look at that, but also around poverty and access to services, things like crisis services. We know the climate change ambition we need to refine. I'm having a conversation with the climate change leads from across West Yorkshire next week about that. It's felt it's very ambitious, to come back to one of your earlier comments. It was a very ambitious view of how we might be a global leader on climate change, but perhaps we need to think a little bit more and refine that so that it's something ambitious but has got some sense of realism there as well. But we do need to do some more focused work on that, which we intend to do at our next workshop. It won't surprise you that broader ambitions around access is in there, GP access, dental, other areas such as that. And in the lifetime of the strategy, we will, as an integrated care board, take on delegation for dental services, optometry and community pharmacy, and some elements of specialised commissioning. So we will need to factor that into our strategy. We want to make sure that our strategy has also got a life course approach from conception right through to end-of-life care, and an ambition to have good end-of-life care for people of West Yorkshire. Then making sure that we've got the right operating model that's set up for our West Yorkshire partnership to be able to deliver what we're saying we're going to deliver. And then having those strong strategies to support that as well. So that's just a bit of some of the focus of the paper. I would really welcome your thoughts as to whether you think that it really does tie well to the Kirklees Health and Wellbeing Strategy, whether it makes sense to you, or whether there's anything that you think that there are gaps, places where perhaps it's not going to make enough of a difference for Kirklees. So I'd just welcome your views and comments. Thank you, Chair.
Thank you very much for that. Any thoughts, comments, questions, colleagues? Everybody's gone quiet. Tom.
Thanks, Chair. Tom Brailsford, Service Director for Resources Improvement and Partnerships. I think probably just picking up on that comment around the reflection of the priorities for SEND and children and young people in general. I think, you know, I'd want to see that strengthened in terms of access to mental health services, speech and language therapies. There are a number of things that we know across West Yorkshire that we were all dealing with that actually aren't reflected in the strategy. So I'd completely agree with that comment that I think there should be more reflection of those children's priorities.
Thank you very much for that, Tom. I absolutely agree with that. I suppose while I'm waiting for people's thoughts to percolate a little, I mean, I love the ambitions. And, you know, we'll address the health inequality gap for children living in households with the lowest income. Absolutely right. I suppose I worry to some extent about the sort of narrative below that, the sentence ensuring that they continue to have the ability to have good health and well-being, access to education and a warm home and a bed to sleep in. And sadly, I think that is an enormous chunk to chew, and I'm not sure certainly that any one organisation or council can address that, and I'm not ultra sure that with things as they are at present, even jointly we can address that. And I don't know whether that in that format then would lead people to be disheartened or undervalue this strategy. Not, you know, if it's not something that can be achieved. There are things in, like access to mental health, dentistry and GPs that are absolutely within the control of partners within this, but that is a huge one to address. Just wonder what your thoughts are.
Thanks. It's a conversation that we've been having regularly about ambition versus realism. It's a real balance, isn't it? There is quite an important piece of work that needs to happen to bridge between the strategy and developing the joint forward plan, in that we have a set of metrics behind our current 10 big ambitions, and there's some work being undertaken to look at what the current progress is around those metrics. But we need to think about, in the light of what the insight is telling us and what we need to change on the ambitions, what are the outcomes we really think we can make a difference with, what we can achieve, then that will translate into the action in the joint forward plan. So it's absolutely a really good challenge, and I think that's where we need to spend some time to think about the trajectories and then who actually has the influence that they can help with those. But it is a good challenge and something we're grappling with daily.
Any other comments, questions or thoughts, colleagues?
Me?
Yes.
Oh. Thank you. Sorry, I've
just hold on, Emily. If we can just bring in, go on, you start and then I'll bring the councillor in. Someone else in the room was signalling at me. No.
Oh, I'm sorry. No, let them go first. I'll wait.
Continue on,
okay.
Emily.
Thank you. I think your point, Councillor Kendrick, about reality versus ambition is a really important one. But actually, if we don't aim for the stars in our strategies, if we don't set ourselves really strong ambitions, then we are never going to make the progress that we need to make. And I wonder if there's just something that can be added in that says we appreciate that this is very aspirational, but we retain our right to hold those aspirations on the part of our populations. That was it from me. Sorry to interrupt.
No, thank you for that. Councillor Mel.
Thank you, Chair. Thoughts? So, just around one part of the Health and Wellbeing Board and the strategies, and that's the health side. And looking at young people education of health. Rough estimates now are that 90% of nearly all disease starts in bad gut, so gut health. So that's everything from obesity, diabetes, heart disease, strokes, etc. So one thing that I've noticed as we've been going through a lot of the comments and the strategies is lack of deep dive into young people's gut health as far as good diet, education, and also dealing with academy and schools and the diabolical stuff that they produce as that what they call food. Some of these children that I meet on a regular basis, it's their only good meal, if you pardon the loose phrase as far as good's concerned. But it's the only meal or hot meal that they'll get in a day, probably, and moving forward, even more children. So I think that the Health and Wellbeing Board and the strategy and the West Yorkshire strategy needs to have more of a concentration on helping with public health and the schools and the education. One of my daughter's friends came round to the house the other day. She goes to BBG in Birkenshaw, and we gave her a meal, and she had broccoli on her plate, and she asked us what it was. She'd never seen broccoli before. Now, if that is a sample of what children's education is as far as good health is concerned, and if we can improve on that and we can add that to a detailed strategy rather than just a bullet point on the strategy, I think that then we're getting somewhere as far as health is concerned for the kids. That's just a thought. Thank you, Chair.
Thank you for that. I mean, this is a strategy, and there are some broad items in here. It isn't a plan, so a lot of specifics. And what you're talking about, I absolutely understand. Are likely to come out much more in plans, but Carol.
Thank you. I might not answer all of your points, but just to maybe give some reassurance, as you say, this is a high-level strategy, and behind it sits a lot of detailed work at programme level. So we had our West Yorkshire Integrated Care Board on Tuesday of this week, and the deep dive topic there was children and young people. And before we actually had the formal part of the meeting, we also had a development session where we spoke to some young people from the Youth Collective, and it was really, really informative. And exactly what you say, that what was coming across was that connection with education providers, and talking about schools as well as colleges and universities was absolutely crucial. We did have a specific discussion in the West Yorkshire Board. It was prompted by the West Yorkshire Children's Programme having obesity as one of its targets. And that was challenged, actually, because in the light of some of the food poverty issues that we're facing, actually there was more of a concern about our children in some communities actually being able to eat enough and eat properly. And the feeling then was that maybe it's less about a focus on obesity and more about a focus on a healthy weight, a healthy lifestyle, and I think people recognise that. So it doesn't answer all your points, but I just wanted to sort of give some assurance that there was a more in-depth conversation about children and young people happening just this week at a West Yorkshire level, and we need to then think about how we connect that with the extensive amount of work we're already doing in our places.
Thank you for that, Carol. I think Phil wants to add to that as well.
One of the things that Emily referenced in the presentation around the Joint Health and Wellbeing Strategy was how we connect with the other parts of the Kirklees system that can contribute to the outcomes that we're trying to achieve. And we've also, in the item around the Health and Wellbeing Board terms of reference, I just mentioned the fact we're looking for a schools representative through the Learning Education Partnership. And that partnership last year published our Kirklees Future, which is the learning strategy for Kirklees. And one of the things we did as part of the development of the Joint Health Wellbeing Strategy was basically go through it and say, is it saying the things that people have told us are important when it comes to children and young people's sort of experience in school? And the answer was an absolutely resounding yes. So recognising the fact there's a gap often, isn't there, between what the strategy says should be happening and people's real life experience. At least we've got, through our Kirklees Future strategy, something to hold on to there to say all the people involved in the engagement around the learning strategy said, this is really important, we agree, what can we do together to try and actually make those changes? So.
Thank you.
It would be unfortunate for me to comment about dentistry being far stronger in this document. It's what we hear, obviously, you know that Healthwatch have talked about dentistry for a long, long time. I think in terms of the ambitions, I think as a West Yorkshire collective, we would like to see that slightly stronger in there. We know that commissioning is about to move over in shadow form. It would be nice to see that a little bit further explained, especially in terms of the tackling health inequalities, because we know that people who experience health inequalities have the most impossible time in terms of access. Thank you.
You want to come in, Esther?
Yes, if I can, thank you. And I, obviously dental services is something that is coming out very strongly. You're right, Stacey. We're at a bit of an odd point at the moment in working through that delegation of services, so it's a little bit tricky at the moment. We're working with NHS England to make sure not only is there a smooth delegation of those services, but we can start to think about the future as well. But there are obviously some constraints around that are sort of embedded into the way it's contracted for, etc. But there'll be more detail about that in the joint forward plan. But certainly we can take that comment away in terms of how it's embedded. Certainly it really resonates in terms of health inequalities as a good example. So we can take that forward.
Thank you very much. I'm not seeing an indication of anyone else wanting to make a comment or question. So can I ask colleagues to look at page 260 of your papers? And there are recommendations there asking us to consider the approach to refreshing the strategy, and I think we are all in line with what's occurred as such, and support the proposition to refine the 10 big ambitions to reflect citizen and partner insight, and I think there have been some relevant comments about that, and note the intention to build a delivery framework which aligns the strategy with the joint forward plan, operational planning, better care fund and winter planning, and maintains an improvement ethos. That was a big sentence. Thank you very much for that. Are we all happy with that, colleagues? Yes? Thank you very much. Can I thank you again, Esther, for joining us and taking us through that?
Thank you for your time.
Please to item 11, which is the last agenda item, and this is an update on SEN, special educational needs as such, and Tom Brailsford is going to start off, and then Paul Harris is going to take us a little further. Thank you.
Thanks, Chair. Today we're just bringing into view an update on the SEN transformation plan. I mean, it seems like a long, long time ago when this board signed off the SEN transformation plan. I think it must have been 18 months ago, possibly. A lot of activity has been taking place since then. We've been involved with something called the safety valve agreement with central government, which is about how we improve access to services but also reduce our overspends with some financial support from the government. And obviously we've had our SEND inspection, which has involved the whole partnership. So it felt like a timely way to bring that together as one. So we're not just covering the written statements of action that have been part of the SEND inspection. We'll cover that context. And I know it's down as a verbal update, Chair, but if it's okay, I think taking through a brief presentation would be easier for members if that's okay. So Paul will take us through that and then we're open for any questions. Thank you.
Thanks very much for that, Tom. My name's Paul Harris. I'm Head of Service in Children's Services for Improvement, Partnership and Voice. And as Tom said, as a headline, we could simply have said that we're just updating the transformation plan and telling you really that's about to commence and things, because you'll remember it was very much a co-production. We worked with partners, we work with parents, and we've also since included young people in terms of making sure that reflects the aspirations for people within Kirklees. But as Tom says, there has been a lot gone on in the last 18 months, not the least the government green paper, which is, again, I suppose, questioning and taking us forward about how we will develop SEND services, because we know there's lots of pressures, both financially in terms of the outcomes, in terms of that following the 2014 legislation. So what we tried to do today is put the transformation plan in a context of how it will address and link those together to bring you up to date, but also really just to inform you that it's the start of our review process for that. So as Tom said, we will talk about the safety valve, which the reason why I think part of the presentation, there's a lot of jargon in this, I apologise, it's not me making up the language, that's just the way it's described, but there are things that you need to understand about the SEND system, so we'll go through those. There is the inspection outcome, and we'll talk about the written statement of action, what that involves, and then how then the transformation plan links those together. And what we're trying to work to having is one kind of unified response to these various developments where all the actions are in one place and things, rather than having lots of different work streams off, which makes it difficult to keep everything in view. And hopefully it will build on discussion that we've already started to have in the various strategies and things, because it's an important aspect of that. If you could go on to the next slide, Phil. Thank you. So just to remind yourself, this was what the transformation plan looked like and things. It's got 5 work streams within it. And it's an important thing to emphasise that the SEND sort of age range is not just the children's services. It goes from 0 to 25, so it covers both children's and adults. And the inspection basis, it's not the only way of looking at it, but it's a partnership. It goes across all of Kirklees. It involves health partners, schools, and a range of all different types of organisations. So what we're trying to do within the transformation plan is get all of the activity aligned in a planned and sequenced way to ensure that it has the maximum impact. And that's why it's something that will take a period of time to deliver. But fundamentally, it's also a culture change programme. It's about the way we do things. It's about how we work with people. So these were the work streams that we put up. And I'll move on to the next slide, because in particular, this particular slide, what I think it just shows you is how there's an emphasis here on early intervention, early identification. And this outlines how we have developed our approach, what's called a graduated approach, which I suppose identifies needs and puts the appropriate level of support within services and settings to help deliver what people need. And we gradually work up from different levels to identifying first concerns to SEND support to more specialist levels and needs. And the idea of that really is that we can try and provide the support as soon as it's needed, as quickly as needed, and in the most appropriate way it's needed. Our aspiration is that you don't necessarily need an assessment or you need a diagnosis to receive that support, that you receive the support when people identify it, and it can come from a range of different people in terms of that. So that's one of the strands that we're trying to do, and it's part of changing the culture of how we provide services and work with people in terms of that. We're going on to the next slide. Here, I think what we also need to recognise that because this programme has been going for 18 months, we actually have already delivered a number of successful outcomes. And I'm just picking up a few things here. If you've looked at the refreshed local offer, which is something that we have to be able to provide about the range and access to services, that has absolutely transformed in the last 18 months. It's transformed through working with people to refresh the offer, to make it much more user-friendly and to provide a much more clear guide to what's actually taking place in Kirklees. It's a really good example of that. The inclusion support offer is something that we've worked on with schools, and that provides really detailed and support to SENCOs who have issues and want to talk things through about particular cases and young people. That provides that level of support. And again, the feedback around that is been very positive in terms of that. So that's, again, an example of the transformation plan actually delivering something and introducing something. Tom's already mentioned the safety valve, and within that context, there's a range of things that we have committed to and already started to see the investment beginning to come on into the pipeline and things. So we've seen investments around special schools. We've seen investments in special schools satellite provision, which is provision placed in mainstream settings, which is linked to the special schools, and there's a range of other priorities there which will transform the capacity within Kirklees and enable more children to have their education and needs met within Kirklees rather than going outside. So that's part of the journey that we're already on. And if you go on to the next slide, Phil, thank you. What that talks about in terms of the safety valve is that's a partnership with us and the DfE. As Tom said, it's about improving outcomes, but it's also about addressing historic pressures on the high needs block, which, if you like, has been an issue for many local authorities, and it's a real pressure in Kirklees. So it's bringing in over £40 million over a 5-year period. What we have to do, though, is to be able to demonstrate to the DfE that we actually are delivering, and we, if you like, actually our project plans are making a significant difference, and the control of the expenditure is coming down. So that's what we're looking to do there. So that's part of the work going forward. Supporting that is a series of detailed work streams which all emanate from the transformation plan. So we've used the work that's gone in the transformation plan to influence the project plans that we've submitted to the DfE. So they're one and the same thing. They are part of a unified approach to how we transform the SEND system. So if we move on to the next slide, the outcome then of the Ofsted CQC inspection has took place in February. The report is available for people to see. It's obviously a public document. It's fair to say it was a mixed report from our perspective. They did identify some strengths, which we're really pleased. Our working relationship with PCAN was complemented there. As a partnership, I think we came really well together in the inspection. We worked really closely together to give a unified response. But they did pick up and identify a number of issues. Most of those issues were issues that we had already identified and were part of the transformation plan. So in that sense, we were playing back to them saying, yep, we know that these are issues. That is why we're putting these plans in place. So we did identify those. The one area that perhaps they placed more emphasis on than we were expecting was around the Healthy Child programme and our compliance in relation to statutory visits. Now, I think we wanted to have a discussion around it's not the only aspects of that, and we identify needs in a number of ways, but from their purposes, they wanted us to meet and be in line with sort of regional and national averages around the statutory 5 key visits and things, and we accept that, and we put the improvement plan within that, and that again will be integrated within the transformation plan. So we have to produce a written statement of action, and this was for 2 areas. One specifically for the Healthy Child programme, which is about the poor, it's what they described as the poor delivery. The second one, if I'm being honest, I think the whole partnership struggled to understand precisely what they meant with the second one, which is weaknesses in the area's ability across services and within settings to identify and meet the needs of children and young people with SEND who are in a mainstream setting. So what we've done with Ofsted is and you'll see, we've said this is what we think you are saying here, and these are the areas that we will address as part of our written statement of action. We're obviously disappointed to get a written statement of action, but it's not unsurprising. Virtually every local authority since COVID who's had a SEND inspection has ended up with some form of written statement of action. And a number of authorities in this area have had far more than 4 points, 2 points rather. So therefore, from our purposes, it's something that we feel we're already on with and we're addressing ahead of the inspection. So if you go on to the next slide, Phil, you haven't got time necessarily to go through the whole thing here, but this is a summary of what we submitted. And we've broken it down into some very specific proposals, and then what we've also then done is linked it in with the submission that we did to the safety valves, telling Ofsted precisely where they will find the activities and where they'll find the detailed programme plans in terms of that. So that's the priority statement for the Healthy Child programme, and the next 2 slides just outline how we're going to respond to the second point that they did. We're still waiting back from Ofsted to hear whether they accept that. They're I'm just being candid here, there is some discussion about whether they'll accept the format in the way that we've presented it. If they ask us to reformat it, we will still be presenting the same actions, but just in a different format and things in terms of that. What we would hope is they will see how we've tried to integrate everything into one improvement plan, and rather than having a separate improvement plan, which is the written statement of action, as well as the transformation plan. That's our aspiration, and we hope that they understand that approach. And then really for the Health and Wellbeing Board, I suppose the questions here are, that's the second part of the slide. If you just go to the final slide, Phil, thank you, is just really for you to note these points, is that it is a whole partnership approach. It's not just the local authority, it's not just health partners, it's a whole system approach here in terms of that. And the ages from 0 to 25. That if we're starting the annual review of our transformation programme, what we will want to do is work with everybody to make sure it's refreshed and highlights the key priorities for the next period in terms of that. It's the essential part of us delivering the safety valve, but also what we want it to do is to link together with the written statement of action so that it's all in one uniform plan, and you're not having to look at several different things and cover a number of different areas, but it's all in one place and it's unified. So that's our approach and our overview of that. I'm happy to answer any questions or feedback or comments in terms of that.
Thank you very much for that. Anybody got any comments or questions? Mark.
Thank you, Chair. A couple of questions reference to children going through the HCP with the child psychologist down in Dewsbury. Just wondered if the shortage of staff down there had been sorted out, because I remember about 18 months ago there was a real shortage of staff and there was problems being made aware of down there. And then the other thing is, in the school itself, when the allocation of monies has gone into a school, is there a real scrutiny on where the money's spent and the progress of that child that the money's been allocated for? Thank you.
Thanks, Chair. Yeah, I mean, educational psychology and the availability of educational psychologists is now, I think, recognised probably as a regional and national issue. So we've been working over, I'd say, probably the past 6-7 months to make sure that, you know, we're competitive with other areas, that actually we're making sure we've got good recruitment pathways with universities. And we've done some really good work in terms of recruiting educational psychologists. However, we do still have an issue with capacity. And some of that is also related to the frequency and the amount of referrals coming in for education, health and social care plans. So I guess you've got quite a lot of demand coming in, and you've got a shortage of educational psychologists. So what we're trying to do at the moment is look at how we can intervene early and help those children and young people earlier, so there's not so much demand coming through the system. But at the same time, how can we attract and retain educational psychologists? We're also working with regional and national partners to think about ideas about educational psychology and the retention of that. So yes, so we are addressing that. I think in terms of the funding that goes to schools, in terms of the first part of the education, health and social care plans, it's clearly monitored through the education, health and social care plan, and we work very closely with school partners and Senkos to make sure the provision that is in the plan is being delivered and the outcomes are being met. So I know sometimes there's some question about, you know, particularly about one-to-one provision for children and young people and whether it's being provided, but we make sure that the outcomes are being met, and the school are very proactive in working jointly on the plan with us about that.
Any other comments or questions? Just to say, for me, I think if we get the early intervention right, so that parents, families don't think that the only way forward is an education, health and care plan, that will start to turn this tank around, really. And it is, at the moment, sadly, that is the perception and perhaps is the reality. If you haven't got an education, health and care plan, you can't get the services for your children that they need and deserve. We're working to get that better and right, really, at an earlier point, because a lot of children don't need that. And alternatively, there's pressures from the schools saying if we're providing this support to a child, we want an ECHP, you know, so it's a bit of a catch-22, but I think this is the right approach and direction of travel. All you want to
Just really to pick up on your point, Councillor, the first part of the response to the written statement of improvement in relation to the second point is about improving parental and young people's confidence in the system. So that really fundamentally is that, and it is moving, it is going back to that culture change about how we work with people, and that we don't necessarily need to wait for a diagnosis. We know there are pressures in terms of getting diagnosis and things done, but we actually don't have to wait for those. But also if we, as you say, pick it up and put the right support early on, it improves people's confidence in the system and they can see that it's actually making a difference in their lives.
Anybody else? We all happy with that? Can I thank you both then for the presentation and coming along today? And that concludes the agenda items. Ladies and gentlemen, you'll be happy to know. Can I thank you all for your attendance and participation? And that concludes this meeting. Thank you.